Axel Grothe from Mayo Clinic presented here in Barcelona a very important clinical studies on the prevention of oxaliplatin-induced neuropathy by the use of calcium magnesium. Unfortunately, the study is entirely, completely negative. Now, this is such a pity, because oxaliplatin is such an important agent in the management of colorectal cancer, both in the adjuvant setting, where it affords an extra 5%, we can say cure rate probably, say long-term disease-free survival, gain on top of fluorouracil that already affords 10 to 15% cure rate, and in the advanced setting. Now, for ages, we have said that the neuropathy have been a major problem for the adjuvant setting, because there we continue treatment for 6 months. And the 6 months is already a lot of treatment with oxaliplatin. But now that median survival has extended up to 25 to 30 months in the advanced setting, with a re-challenge with oxaliplatin, that's a major problem again. So it is with great sadness that we greet these negative results by Axel. The study has a tremendous internal validity. Internal validity meaning how good the study is. It's 350 people randomized to 2 regimens of calcium magnesium and just a control placebo. And unfortunately, it is completely negative. Charles Loprinzi presented the study at ASCO, and the conclusion has been the same as the one presented here by Axel, and that is just a 2-line conclusion. Unfortunately, the study is completely negative. There is a good news, though, and that has not to deal with the neuropathy intended in terms of peripheral sensory problems. But the good news regarded the neuropathy that induces pain accounted for by oxaliplatin. And the good news comes from an unrelated study. But this second study that was published on JAMA this year actually presents data about duloxetine, that is a drug that is registered by FDA for the use of diabetic neuropathy, and that produced a very significant relief from the pain induced by the neuropathy due to oxaliplatin. So again, very straightforward messages here. Number 1, calcium magnesium does not prevent oxaliplatin-induced neuropathy. Number 2, we see some light on the horizon due to this second paper has to deal with duloxetine in the cure, in the treatment of oxaliplatin-induced neuropathy causing pain.